What to know about high blood pressure during pregnancy? High blood pressure, or hypertension, can occur during the first, second, and third trimester of pregnancy. There are three types of hypertension during pregnancy, and each has slightly different features. In the United States, high blood pressure occurs in around 6 to 8% trusted source of pregnancies among women who are 20 to 44 years of age. Without treatment, this issue, also known as hypertension, can lead to serious health complications for the pregnant person, the infant, or both. But in most cases, hypertension is preventable and treatable. This article explores the different types of hypertension that can occur during pregnancy, including their risk factors and complications. Types of hypertension in pregnancy. Chronic hypertension. A person with chronic hypertension either had high blood pressure before pregnancy or developed it before week 20, in about the first half of pregnancy. Gestational hypertension. This type of high blood pressure starts during pregnancy, usually in the second half, or after 20 weeks. A doctor diagnoses it if systolic pressure is at least 140 mm Hg, diastolic pressure is at least 90 mm Hg, or both. The person will also have no protein in their urine, no other heart problem, no kidney problems. While the rise in blood pressure is usually small, a healthcare professional will likely monitor it every week. If a person's blood pressure reaches 160/110ths of a millimeter Hg or higher, serious complications can result. Gestational hypertension usually goes away after delivery, but it can persist and either become chronic or increase the risk. Trusted source of chronic hypertension later in life. Preeclampsia. Preeclampsia involves high blood pressure that occurs during pregnancy or after delivery. It can have severe effects. This condition usually develops after week 20, often in the third trimester. If it happens before week 34, doctors call it early onset preeclampsia. It may develop in the weeks after delivery, but this is rare. Trusted source. Experts do not know why some people develop preeclampsia and others do not. The risk may be higher for people who have previously had preeclampsia, have chronic hypertension, are carrying more than one fetus, have kidney disease or diabetes, have systemic lupus erythematosus, sometimes known as simply lupus or SLE, have a body mass index of 30 or above, have not been pregnant before or within the last 10 years, are aged 35 years or above, are black or have a low income, as health inequity can affect the risk, have a family history of preeclampsia, have had previous complications during pregnancy, are pregnant through in vitro fertilization. Complications of hypertension for the pregnant person. If hypertension is severe or uncontrolled, it can cause complications during and after pregnancy for the person and their baby. The specific complications depend on the type of high blood pressure. Having hypertension during pregnancy increases the risk. Trusted source of more serious health conditions later in life, such as chronic hypertension, heart problems, and stroke. In addition, a person with chronic hypertension before pregnancy has a higher risk. Trusted source of developing preeclampsia and gestational diabetes during pregnancy. Risks of hypertension for the baby. High blood pressure can increase the risk of health problems for the newborn, such as preterm delivery, small birth size, death during infancy. High blood pressure during pregnancy can decrease the flow of nutrients and oxygen through blood vessels, affecting fetal development. If an early delivery is necessary, this can cause complications such as a low birth weight and difficulty breathing if the baby's lungs have not yet fully developed. According to a 2018 review. Trusted source, hypertension can increase the risk of these health conditions for the parent and the child. Cardiovascular disease, chronic kidney disease, other metabolic disorders, stroke. Signs and symptoms. The American Heart Association trusted source notes that most people with hypertension have no symptoms, so a person may only find out during routine screening. Monitoring blood pressure is an essential part of prenatal care. Having regular prenatal checkups can help a person keep track of their blood pressure and other vital signs, and access treatment if necessary. Treatment. The best approach depends on the type of hypertension. Chronic hypertension, a doctor may recommend continuing to take blood pressure medication during pregnancy, or they may recommend a different medication. Gestational hypertension, a doctor may recommend self-care strategies to manage hypertension and will continue to monitor blood pressure and check for preeclampsia. Preeclampsia, the healthcare team will monitor the person's condition and may recommend early delivery, in some cases. A healthcare professional can recommend ways to manage, and if possible, prevent, high blood pressure before, during, and after pregnancy. Prevention. It is not always possible to prevent high blood pressure during pregnancy, but some self-care strategies can help. They include exercising regularly, having a healthy diet that focuses on whole grains, fruits, and vegetables and is low in salt, quitting smoking, if applicable, and avoiding second-hand smoke, limiting alcohol intake, for people who drink, having regular health checks, taking steps to reduce stress, reaching or maintaining a moderate body weight, managing conditions such as diabetes. Medical professionals tend to recommend regular blood pressure screening, especially for people with risk factors, to detect it early. At the end, it is requested you to please subscribe our channel.